As part of the law.MIT.edu special release on COVID-19 responses and frameworks, I'd like to talk today about a new project that really got our attention from a longtime collaborator, Susan Joseph, who's part of a team that's put together a coronavirus API. It's a public health initiative that unleashes the power of this data that's currently really trapped silo by silo with a public API that can get it together and to get it where it's needed. So with that, I'd like to ask if the members of the team could introduce themselves and any disclaimers that you might want to make about legal practice or federal employment and the rest. Now is the time to do it as part of your intro, and then we'll dive right into your project. Susan, why don't you get us started?
Sure. Hi, all. Thanks, Daza, for having us. I am a lawyer and a consultant in blockchain, insurance, financial services, data use, et cetera, all those sorts of things. And so since I'm a lawyer, I'm going to put the legal disclaimer up that I'm not your lawyer. None of these people are your lawyer, your accountant, your advisor, et cetera. And this is for informational purposes only.
Beautiful. And maybe you can hand it off down the line to your team.
Sure. George?
Sure, I'm happy to go next. Hi, I'm George Pullen. I'm an adjunct professor at the University of New Hampshire. I also have another role as a senior economist for the Commodities Futures Trading Commission. I'm not speaking in that capacity. I'm not representing them. So all of these thoughts and statements are my own, and my work on coronavirus API is self-motivated and funded, and I'm doing it through the University of New Hampshire. Thanks.
Hi, I'm Danny Yang. So my background is big data, AI, machine learning, and blockchain. I've recently done a couple of startups in the blockchain space, and I've been basically building coronavirus API to pull state records and aggregate it in one place.
Okay, terrific. And so you all came together with an idea that if only there were an API for coronavirus data, things would be better. So can you introduce everybody to, what is this coronavirus API project? How does it work? What does it do? And why is it needed?
So maybe let me give a little bit of background, and then Danny, you can go and maybe give a demo, would be a good idea. So we came up with this idea when we saw the way that data was being reported. Sometimes it was taken off a site, sometimes it was put back on a site. And we know that public health data is the arbiter. That is the data. It's mandatorily required to be reported. So we wanted to use this independent source that is public and make sure that that was available to all 50 states, because prior to this, there was really no way for this data to be easily aggregated or even aggregated in part, like by region. So maybe bordering states could figure out what was coming down the pike. And that was part of the impetus of this. And we wanted it to be an easy to use tool. So Danny created the API. And we have made it freely available because this is a public health crisis and we want to help the helpers. And it is useful for forecasting, planning, and preparedness. So that's kind of the background of it. And so I want to turn this over to Danny to explain how it's built and maybe do a bit of a demo.
Yeah, we'd love to get a screen share of the API in action. I've got it on my screen here. It's
sure.
It's impressive.
I will share it. Okay, so I'll share the screen. Yeah, so basically, I guess a couple of weeks ago when we started this, and you can probably see when we started because you can see the data starts when we started. I guess early March. Are you seeing my screen now?
Yes. Yep. Looks good.
Yeah. So basically, before so this is the starting point of back in February, there's already this, and you can see how many cases they have, and it's great, actually very useful for people, and it's quite popular site. But we want to kind of know the source and have it more official, right? So like what's the official count from California or Washington State? And you can go to those websites and look at the counts. So for example, let's see. So here I just sort by state. So like on California, you can come here and you go down and you see the count is this many cases, this many deaths today. And they added these. But over the course of this project, they've added more stuff, which is great, and we'll be pulling more information. But first we want to get just the most useful numbers, right? Like cases, deaths, and also how many were tested. So in case of California, actually getting the tested number is a little trickier. And actually, so we built this automation that can do this. It'll actually click through to the news releases and look for the most recent news release, and then go into this page and find the number, which is here. This is how many tests. And so actually, the site should be updated because you can see when things were crawled and everything. So let me go back here. And you see California, it was last updated. Oh, okay, the site hasn't been up, or rather, they haven't updated their numbers yet. This is the most official, which is what we just saw on the page. It was from the last time they updated was about 17 hours ago. And we crawled pretty much hourly, actually more frequently these days. So they probably updated the site 17 hours ago, and we got it 16.8 hours ago with the numbers that I just showed you on their page. And so this is where these numbers come from. And you can get it for all these different sites. So if you see the recent crawls, you can see that, like New Jersey, they updated their number quite recently. And this is what New Jersey reports and so on for these every state. And you can see which states did the most testing, which states had the most deaths. This is the aggregate for all 50 states plus DC, and we also have Puerto Rico in here, PR. And then some basic charts that show the trends for deaths and positive cases. And then you can also go to each state and see the details for that state, say New Jersey. And you can see numbers for New Jersey. Or you can see comparisons between the states. So this is like the top 10 of positive cases. Maybe you just want to see New York against maybe Pennsylvania. So here, New York.
Interesting. I didn't realize that you could filter and do comparisons like that. That's terrific.
Let me jump in when Danny's on the screen, because I think it's important to highlight this as well, that if you look at the time series in CSV format down below there, so you can get this from the API, but you can also get it right there. So even someone whose forecasting and planning skills constitute them using Excel, they're able to pull this in freely and use it. So they can say, okay, I'm a healthcare provider in Mississippi. What does it look like for me if my state has a reaction similar to that of California or of Tennessee's? And they can overlay this very easily using these formats that we're providing freely.
That's terrific. So you've got the display versions there that are updated, kind of automagically, and also a bulk download in standard CSV format, so people can explore the data in Excel or do something fancier in Tableau or what have you. Is that about right?
Yes, and you can also go to each state, so the state view, and there's also, you can get the JSON, or this is a CSV view for all the data for that state, or you could, here, let me refresh. Or you can go to the JSON output, and you can see the JSON view for.
Yes, JSON, the lingua franca of data that's free and interoperable on the web. And that's going to bring me to the next question when your demo's done. But please continue.
Oh, that's it. That's a quick overview of this.
Okay, outstanding. And, really kudos and hat tip to the whole team for getting this up and running so quickly, making it so functional and useful. I hope people will take care to bookmark this page. It's CoronavirusAPI.com, and tweet about it, LinkedIn about it, so that people are aware of it. And first is from the MIT Computational Law Report perspective at law.MIT.edu. We very much favor open data, accessible data. We think laws and regulations and legal information, especially public information, ought to be easy to access, not just at the display level, but also to access like programmatically, through software, through an application or a service that can, like through an API, just get the data along the lines of what you're doing now manually, well, not manually, but with scrapers, basically going to the website, the display version, and grabbing everything. It's a high level question, and also to clarify what might be different. If the states were to publish this information through standard APIs, at least standard to their state that were documented, would that make it somewhat easier for you to then collect them all at a 50 state level and then display it? And, especially if there were, API functions like pub sub or notices and alerts that could push when new things were available?
Well, I think you partially answered your question, which is that even if states were to go to a uniform format for themselves, we would still have different formats among the 56 states and territories. So I just want to sing Danny's praises quickly because he's maybe underselling how difficult the job is that he's taken on. But it's not just that we have 50 different formats, it's that the states are changing their own formats on a regular basis. So even if the states stop changing their own formats, we would still have to make it interoperable between all 50 states. And so by providing this via the API feeds, we make it so that people have transparency in a single format.
Yeah. And so may I ask, is there now a group of, say, like from the IT departments or the web team of the public health authorities that are publishing this stuff where they're talking about possibly, using more standard APIs or formats, or is that sort of not happened yet?
Well, I think most of those groups are drinking from a fire hose at this point, and that may not be their top priority to discuss. It's one of our top priorities to discuss for sure, because we think that this information is just so valuable for planning and behavior and resource allocation. Certainly even supply chain management. And so what we have noticed though, is that we know that public health doctors are using this information to do their planning for things like group homes and other types of facilities where they might have had their budget cut, but they still need to figure out how to do accurate analyses. And this is reliable for them, transparent, uses the data that they can rely on, that they would rely on anyway, because it's the publicly mandated data. So we know that it's very useful for them. We know also that there are some postdoc researchers using it, and we know that certain states are looking at it and using it.
Yep.
We just would like more to do that.
Right, and we've been, the states and the counties that have reached out to work with us and to get this data and understand how they can use it to their benefits. We've been working with, we're happy to keep doing that. We just want to get this into the hands of as many helpers as possible. And it's the it's the geek power movement, right? Like we can help the helpers in their own ways.
Yeah, and APIs are such force multipliers for this geek movement to get that data out in an accessible, in a usable way. So again, kudos and hats off to you. So question now, what do you, so 3 people, you also demonstrate that 3 people can do a lot when you collaborate together and are doing the right things. But I wonder, do you have any needs that you'd like to kind of put out there to the community for help either in your, on your code base or with deployment or otherwise? Like what are the, well, I should ask first, what's next for the project? Including just continuing to publish what you're doing, but if there's anything new or different that's in the roadmap, we'd love to hear it. And what needs do you have?
Yeah, so on the development side, basically crawling and parsing. So parsing is what breaks all the time. Like crawling the pages is pretty easy, but then we had to parse it to pull out the data. It's unstructured data. Usually it's unstructured data. Sometimes it's nicely structured. But as soon as they change a page, it breaks. And it's about maintaining that. So help there, developer help there. So the code's all open source on GitHub. And also right now we're doing the states. We'd like to go to the county level and collect all the county information. So that's going to be a lot more work to basically write all these crawlers and parsers and fix parsers when they break.
And we've had good support too. I mean, there's the 3 of us on the call here, but we've had some great volunteers that have been helping also. And the more people that are able to help like that will make us able to build out the county table and to also allow maybe anchoring to blockchain for long-lived transparency and other initiatives that we'd like to incorporate.
So also, to the point of the county list, there's over 3,000 counties in the US, not all report. And some report on their state pages and some not, and it's not all necessarily in a scrapable form. For instance, they have drop-down menus that you've just got to keep clicking on, kind of like what Johns Hopkins does. So having the background research of the data sources would also be helpful. I have been pulling together data sources, but we need to verify them before they go into anything built, because it all starts with the official data.
Understood. Yeah, and at the county data, it's an area I've played in for many years now, and obviously it is irregular and sketchy, and some counties don't provide information in a form we would recognize as data to start with. So you've got your work cut out for you there. One just quick bit of feedback. I was looking for a link to the GitHub repository on your site, and it wasn't obvious where it was, or I'm not sure if it's there. So if there were a nice link somewhere in the FAQ or about us or somewhere, that might be helpful as we drive people to the URL CoronavirusAPI.com who might be willing to and able to help down in the code base. That would be convenient. So there's some user feedback. And again, I just want to congratulate you all and thank you for coming into action in a volunteer spirit of civic contribution to make this available. And I really do think this is a great example of what we ought to be doing more broadly as part of the response to this crisis, including with legal information. So hear that. So thanks again, all of you, and please keep us updated on how the project unfolds.
Thank you, Daza.